Good morning. I am Diane Manning, President, CEO of United Services. We're the local mental health authority and the mobile crisis provider in Northeastern Connecticut. We're partners with Troop D in the FY22 pilot expansion of the crisis model, and I'm testifying in support of Raise Bill 5178 concerning expansion of this initiative throughout the state. We've been working with Troop D leadership as well as our local police departments, and in fact, Troops C and K, who cover parts of our area, to develop protocols for working together to divert individuals who do not need police intervention into the treatment system. These individuals usually exhibit behaviors that cause community members, including their families, neighbors, landlords, business owners, etc., to call the police to intervene. If these individuals are not presenting a danger to themselves or others, trained clinicians can offer help in a variety of ways once they assess the needs of the person involved. They may work to get someone connected to treatment, back on medication, into safe housing, get them food or clothing or heating assistance, whatever it takes to stabilize the person so that the police are not making repeated visits to respond to something they cannot fix. Typically, we meet the police at their station or in the field, wherever makes sense. Once we are sure that no one is in imminent danger, the clinician engages with the individual of concern and tries to identify what is the most immediate need. They then work with other local providers to connect the individual to supports for the longer term. In our case, we can connect individuals to our internal services, including a new federally funded program that allows us to engage with these individuals for up to 45 days to be sure that they're connected. The crisis funding supports a forensic services manager and a specialist who provide first-line response to calls for assistance from the police. They are also available to provide training for officers. Both Troop D and our local police departments welcome the opportunity to work with us to reduce the unnecessary responses to people who need services and treatment. We will also be working with the police departments to identify protocols and provide training so that officers have ways to determine who might be successfully diverted to our services. The outcome of this project is that police will not be tasked with responding multiple times to people who need different service, and that these individuals will be able to access treatment and supports that they need in order to not interact with law enforcement unnecessarily. Also, the individuals that are referred to the crisis project are able to access treatment and other supports so that they do not come to the attention of the community and eventually the police when that is not appropriate. Thank you.
Thank you very much, Ms. Manning. My co-chair, Senator Austin.
Further questions?
So my question is for Representative Lanoue, but I just want to say thank you, Diane, for coming on. I really appreciate all the work that you do. Brian, this Representative Lanoue, this bill here, does this take the place of the bill that you had wanted for Troop D and E, relatively speaking, for the crisis units? Does this fix that issue?
Not necessarily. If what this bill calls for is an expansion of the crisis program throughout the entire state. What we're looking for in appropriations, what we filed together, Senator, was to ensure to keep the existing funding in place for Troop E and D.
And the dollar amount it's the exact same program, though, right?
That's correct.
Okay, I just want to make sure that we're talking about the same thing. There are so many different crisis bills out there, and I just wanted to make sure we were talking about the same thing. So
yes, this is crisis with the acronym.
And can you get me the exact dollar amount I need for D and E?
We can certainly do that. Last year it was there was $200,000 appropriated
for both
for fiscal year. For fiscal year 22 for the crisis program. So for
was D 200,000 and E 200,000?
E is funded in the DEMIS budget.
Okay. And was it about the same amount, Diane?
I'm not sure. I know that the 200,000 is for Troop D.
Okay, great. Thank you very much. Thank you, Madam Chair.
Thank you, Senator. Representative Hayes.
Thank you, Madam Chair. My picture jumped and I couldn't even see myself. So, good afternoon, Brian, and good afternoon, Diane. It's always nice to see nice, warm faces from the not so quiet corner. I think everybody knows that I've been away from law enforcement now for a few years, but I do have to say that just before I left, I began to notice a trend where my officers, anyway, were responding to calls or incidents for mental health, and that jumped so that I could estimate that was about 40% of our calls at that time. It was frightening to me because the officers, although they do get some training, they don't get intensive training, and to have them respond to that type of call and not having to go through the extensive having, I guess, total cross training between mental health and law enforcement, it was concerning to myself and I'm sure other police chiefs across the state. So I am in total support of this. I was just wondering if you could help me out with the in-house social worker. Is that like continuously scheduled for like 40 hours, or are they called in as needed? And do you foresee any trouble with staffing of those positions with so many other mental health programs on the forefront?
We actually have a forensic manager that works with the police department as a problem solver and setting up, going to the meetings with them and really doing some case planning around difficult cases. But everyone on my crisis team, and my crisis team is expanding to 12 individuals, everyone is CIT trained. And because we cover such a large area, we don't actually live at the police station. We actually are working from the community so that we can respond quicker. So we have a large team. This is just helping us to have a specialty in working with the police on the team.
Thank you for that. And, I just want to express how important I think this is because from a police response standpoint, there were two options. So it was either take the individuals to the police station under arrest or bring them to the local emergency room where they were already so overworked that became a problem. So, I'm in 100% support of this. I want to thank you for doing that. I think it's something that's greatly needed. And Brian, I'd also like to say that I support your stipend bill as well. I think that's something that came out last year that we worked hard on, and it should have gone over the finish line. I think both of you should go over this year. Thank you both for being here. I appreciate, Diane, I appreciate greatly what you and your agency do for the Northeast corner. And thank you for being here with us today. Thank you, Madam Chair. I'm done.
Thank you, Representative Hayes. Ranking Member Representative Howard.
Thank you, Madam Chair. Representative Diane, good, still morning, barely, but good morning. And then thank you both for being here. Diane, specifically for what you do, and Representative Lanoue for testifying in favor of this bill. And I know you've been a strong advocate for it. In this committee, as well as in the legislature, we talk about the word crisis a lot. We talk about in policing, we talk about social workers, you say CIT, which is across the crisis intervention team, and the work that Cable does with Louise and her team. And I'd just like to make sort of a summary of the stuff that goes on and ensure that we're understanding as a committee, as a legislature, what we're doing here, that by nature of their 24-hour day, 7-day operations, police officers are, as you heard the former chief say, in large numbers called to people who are in crisis, meaning at that moment in time, they're needing assistance and somebody's calling for them or they're calling for themselves, but the police officers respond by nature of their 24-hour day, 7-day operation. CIT officers are specially trained to deal with individuals in that moment of crisis where they can recognize it, not only recognize it, but also diffuse the situation. We use the word de-escalate. And then this initiative is really a supplement to that in the follow-up. So while the CIT trained officer can, diffuse the situation for the moment, that officer is not going to call that person the next day and say, hey, did you get this service? Did you go to that? Et cetera, et cetera. That's really what this crisis initiative is the supplemental follow-up to that, working in conjunction with those officers who are responding. Is that an accurate depiction of what we're accomplishing here?
It is. The design is such that first, the police need to decide that it's a safe situation for somebody else to be there. So our staff are not out first. But we're frequently there with the police. And if the police have determined someone is not a danger to themselves or others, then our staff can step in and the police can frankly leave the situation. And we take it from there and do the follow-up. We, because of the crisis funding, then have the opportunity to really feed back to the police on what's going on with the individual, what our plan is. They can be part of the plan if someone disappears from treatment again, so that we know that we're working together to try to figure out what's going on with someone, and not really have the police be the primary responder going forward.
Right. And thank you so much for that, because again, you know, when folks don't work necessarily in this every day and you hear the word crisis, as what you heard one of my colleagues say all over the place, and CIT, which has word crisis in it, and you know, it seems like they're really parallel bills, but really they're all spokes in a wheel of resolving an overwhelming issue within our state. So thank you for that, and thank you, Madam Chair, for the time.
Representative Howard, may I just add to the answer here to your question? I think it's also important to note that there's several different ways that somebody can get help through the crisis program. You know, police officers, even through community-oriented policing, our state police do a wonderful job of that. Our local police certainly, and just through the course of their duties, they may be at an event and just working with the community, and somebody comes up to them and says, you know, officer, I'm really white knuckling it right now. I'm having a real hard time. I have this addiction. I'm really struggling. I don't know where to turn. That officer can now do the take the information, do the immediate follow-up with the clinician, get it into the clinician's hands, and they work well together. So this is a wonderful way of allowing law enforcement, folks like yourself, to do what you do very best, and that's law enforcement, and allow the clinicians to focus on the mental health component, and really, like you said, working well together, and bringing in the community partners, and really doing this as a community and a state effort. So thank you again for those questions.
Thank you, Madam Chair.